The full committee, Chair Rodgers for 5 minutes for an opening statement.
I'd like to thank our witnesses for being here today. As many of you know, our son Cole was born with that extra 21st chromosome. Most of you know it as Down syndrome. And today, Cole is a 16-year-old. He's a high school student with big dreams. He wants to be a football player or a coach, a pastor, a race car driver, and he's dreaming of going to college. For people with disabilities like Cole, others born with intellectual and developmental disabilities, or even seniors facing physical limitations in their everyday lives, the sky is truly the limit to their potential. Long-term care services and supports, whether that be those provided by home and community-based services, or HCBS for short, or in nursing home settings, are key to ensuring that people can live successful and independent lives. As many of us know, there is a shortage of long-term care providers. Since 2020, we've lost tens of thousands of workers across both HCBS and nursing home settings as workers left the field due to burnout or in pursuit of other opportunities. While these stressors were present in the long-term care field prior to the pandemic, they've gotten worse. Even as other parts of the healthcare field began to return to pre-pandemic employment levels, the future of care for seniors and people with disabilities depends on us finding a way to support long-term care workers. I've been troubled by recent proposals from the Biden administration that, while they may be well-intentioned, I am concerned are going to further undermine this workforce. The administration proposed the so-called Medicaid access rule, which would require home health agencies to pass through a minimum of 80% of all reimbursements directly to the direct care workforce. State Medicaid directors and advocates, however, have raised concerns, stating that such a high threshold is out of reach for most agencies and would require agencies to have to reduce service and staff to be able to ensure that they comply with the rule. Put simply, this proposal would actively undermine access to care, running counter to the very name of the rule. Additionally, just last month, the administration followed the access rule with a proposal to require minimum staffing levels for nursing homes. Like the access rule, this minimum staffing rule is setting unrealistic staffing thresholds. Independent analysis have found that as many as 80% of all nursing homes, 80% of all nursing homes will not be able to meet the requirements of the rule, meaning that facilities are going to have to increase costs even further, reduce censuses, and stop accepting new residents, or potentially even close. We all believe in access to high-quality care, but proposed requirements that are untenable for 4 out of 5 nursing homes do not represent a serious solution. And those who rely on skilled nursing care deserve better than a proposal that will dramatically reduce their care. These top-down approaches are not the way forward in supporting seniors and people with disabilities. And it's my hope today that we will begin a conversation on ways that we can find more meaningful solutions to help those in need. We cannot let this rule simply go into effect and watch idly as individuals with disabilities and seniors lose the support they need to maintain their independence. We do not want to see people forced into hospitals for chronic conditions that could have been avoided. You know, I often say this, I am proud of the bipartisan work of this committee, from passing Lower Cost, More Transparency Act, to making healthcare more affordable and accessible, to reauthorizing Mr. Guthrie's Support Act to help those struggling with substance use disorder. And I'll note that my colleague, Mr. Pence, has just led a bipartisan letter to the administration with over 90 members raising concerns with the nursing home staffing rule. I hope in the spirit of bipartisanship, we can discuss these policies and find a pathway forward that helps people with disabilities and seniors get the access and the care that they need. I yield back.
Gentlelady yields, the chair yields back.